So I think that undoubtedly the update to the McDonald criteria is definitely going to be the highlight of ECTRIMS 2024, because this is going to immediately change everybody's practice when they get back to work. Although they did say to us yesterday, wait till the paper's published, because who knows what the changes will be. I guess I view this as a sea change in the way we diagnose MS. Firstly, because we no longer have the requirement for a clinical syndrome like a relapse or progression, so we're going to be diagnosing MS in people who've got either atypical symptoms or no symptoms. And I think the other big change is going to be the new diagnostic biomarkers are going to be integrated into the diagnostic criteria, whether that's optic nerve biomarkers, things like MRI, VEPs, ICT, that we're already using to some extent, or imaging biomarkers that many of us, including myself, don't really have any experience with, like central vein sign or paramagnetic rim lesions. So I think this is going to be interesting times ahead. So I think that one of the aspects of the session that I contributed to was around trying to have a unified set of diagnostic criteria for MS. The motivation for that was really that MS is one disease. Primary progressive MS is not really distinguishable from relapsing MS, except based on the very initial symptoms. You can't differentiate the conditions based on the MRI or lumbar puncture or evoked potentials or genetics. And we're dealing with one disease. And so we presented some data from the Magnums network showing that the diagnostic criteria used to provide a diagnosis of relapsing MS work just as well in the context of primary progressive MS. And that's been reflected in changes to the McDonald criteria that we now are going to be using the same set of criteria to diagnose RR and PPMS. Unifying the diagnostic criteria comes with some potential challenges because there can be differences in the clinical presentation of the two conditions, but the MRI findings, lumbar puncture findings are very similar. And the new diagnostic biomarkers like paramagnetic rim lesions and central vein sign are also seen in patients with primary progressive MS as well as relapsing remitting MS. I think the bigger challenge to unify MS diagnosis more broadly is how we can make sure that across the world and in different healthcare settings and different levels of medical resources, people can have equitable access to a diagnosis of MS, and that does represent an ongoing challenge.